Hello everyone, my name is Angel Portman and I'm the CEO of Breckinridge Health Incorporated. If you follow our page very much, you know that from time to time we have patient testimonials about different services that they've received here. And when people have a really great outcome, they often like to let other people know. So today that's exactly what we have. We have a patient of ours who has had a wonderful journey here with us. It's been wonderful for us, at least. And he's just made tremendous progress since he's been here. So I had with me Mr. Roger Ledridge, and I'll just let Roger explain a little bit about his time here with us and kind of where he's at today.
Well, I'm very much at the end of my journey because Friday I'm going home after 100 days here, and I had a stroke on November 23rd. I spent 2 weeks in Louisville Hospital at U of L and Fraser Rehab, and then got to come home here. And I think being here in our local hospital has been as much therapeutic value to me as just about anything else that I've done. But the therapists here are just absolutely wonderful. As Angel said just a minute ago, when I came here, I could move my thumb and my finger, and now I'm walking. It's not very pretty, but I'm walking. And the whole experience here is just, I really can't describe it, how good it is. It's a 5-star hotel. And everything about it, from housekeeping on up, people have left me little notes that worked here, and they've all been very encouraging. And it's just, I can't imagine being anywhere else, and I really think the progress that I've made, I'll have to brag on the hospital for that. And something that really has impressed me, every single person who comes through that door to see me for whatever reason on their way out, you included, have said, "Is there anything else I can get you?" And that's just unbelievable. And we are so fortunate to have this hospital here, number one, and I'm so fortunate to be a patient here. Although they started kidding me, for as long as I've been here, they said, "You're not a patient, you're a resident." So, but I can't say enough about it, and I've thought several times, what if we didn't have this here? Well, we wouldn't even have the heliport that I left from to go to Louisville for the hospital up there when I first had the stroke. And if people don't know about our hospital, they need to know, because it's just everything about it. Now, obviously, we can't do the highly specialized stuff that you do in a major hospital, but if you have to be prepared to go up there, this is a great stop to be, and I just can't say enough about it. And I'm fortunate also to be on the foundation board, and I've been on it. This is my 3rd year now, and I've learned a tremendous amount about the hospital being on that board. But for the last 100 days, I've seen the whole different side of it, because I'm now on the other side of the coin as a patient instead of a board member. So again, it just it can't be any better than what it is. And I commend you very much on how you operated the hospital and how you do operate the hospital, and have found the number of good people that you have that work here. Yeah. I haven't had a single bad experience anywhere at all in my 98 days now. So, but I told Angel the other day, I said, "Is there any way I can check out and be gone for a couple of days and come back for another stay?" Not yet, but anyway, people just need to know that what a jewel we have here, and if you need medical help, this is the place to come. If you have to be transferred on later on for more specialized stuff, that's fine and dandy, but people need to come here first. And with all the stuff I've seen and that we've shared in our board meetings, there's been a lot of rural hospitals that have had to shut down.
Right.
And well, it would be a terrible loss if that ever happened here, but I don't think that'll happen as long as you're here.
Well, thank you, and I'm definitely going to do my very best. You're right. You know, we're here every day, and we're here, you know, on the acute unit where Roger is, and I'm aware of things that are happening in the ER as well as in our clinics and really just all over the hospital. I know for sure that we make a difference in a lot of people's lives every day. And again, as Roger said, there are some things that we're not going to do here, that we don't need to be what the hospitals in Louisville are or elsewhere. We have our own purpose, and we serve that purpose very well. I think Roger's a wonderful example of that. He's been here with us as a part of our Rehab to Home program. And Rehab to Home really is meant to do exactly what it's done for Roger, and that is to help someone who has had a stroke or a traumatic accident or a surgery or even an illness that has left them unable to return home independently. If they qualify and if insurance is allowed, you know, to bring them here, we can bring them here and do therapy. I have to say again, Roger's right in his compliment of the staff. I'm very, very proud of all of the staff here, and I'm proud of them every day. But when I see them work as hard as they have with someone like Roger, who had so much improvement that he needed to make to be able to get home, he and his family have become like family to us, and it's that way with all of our patients who stay with us here for any length of time at all. This is just small town, and you can't recreate this in any other environment. You can build nice buildings with a lot of nice equipment, but this feeling of being at home where there are people who are family and people who care about you just cannot be duplicated. So it is absolutely our most sincere effort to keep it here and keep it available and continue to provide services like Rehab to Home. And I do think there's one other important thing that we should most definitely get included here in the testimonial, and that is, even if you are someone who is struggling yourself, or you have a family member who's struggling, if you don't need us right now, but maybe it just seems that you have a medical situation that just seems too much to overcome, I would tell you, look at the man here to my right. It's an emotional thing, you know. Nothing that we can do, nothing that my therapy staff can do, nothing that nursing staff can do. His discharge planner has been, wonderfully involved, but nothing that we can do will work if the patient is not committed and willing to work hard to achieve the goals that are important to them. And there's not been one day that Roger has not been ready. So it's really a kind of a magical thing to bring together people who have the skills to bring somebody from moving their thumb to walking. But that only works when you have a patient who's motivated to do that. So if you or your loved ones need a hand, something along the lines of the Rehab to Home program, certainly get in touch, see your primary care provider. And if you yourself are just struggling with a health issue that seems insurmountable, I would advise you just keep in mind you can do it. It's amazing what the human body can do when you put the full commitment of your mind behind it. So, and you've got good resources, and we're right here, and we'll continue to be.
Yes, ma'am. And I'll tell you another thing that really, really impressed me was, I don't know, it was a Friday, and you were short-staffed that day, and I was going down to therapy, and here Ms. Portman was out working. She was working the floor. Of course, she's a nurse, so she knew how to do that. But I told you how much that impressed me, and I really meant that, because you don't see the leaders most often getting down in the trenches.
Yeah.
But you did when the time was necessary and got it done. So.
And that is the way we run this hospital. We're all here for one purpose, and that is the patients in our care. And it doesn't matter if it's me or who it is. If you can help, the expectation is that you will. And I think that's what overall makes it as special a place as it is. We're all just working for the same thing, and that's the betterment of our patient. So.
Well, please share the different clinics that we have now here at the hospital, because if I do it, I'll leave somebody out.
All right, well, I may leave somebody out, but let's try. Okay, so right now in our outpatient clinics, of course, we have our 3 rural health clinics. We have our clinic in McDaniels, our clinic here in town at Breck Primary, and then we also have our clinic in Cloverport. So those all clinics serve primary care needs, and they all accept patients all the time. And then here on the hospital campus, we have our general surgery program with Dr. Gillum. We have Dr. Peebles, who is a podiatrist and a wonderful physician, just a great guy. He's new to us, and we just really enjoy having him here. We also have our orthopedics group, and then we also have Dr. Sika in pain management. Outside of that, we also have outpatient physical therapy, occupational and speech therapy. We have our Tranquility program for older adults who may need some help with loneliness, coping, that kind of thing. It's a wonderful program as well and serves a lot of people very well. We also do cardiac and pulmonary rehab. Also here in the hospital, we offer nuclear medicine studies, and then all of the typical studies that you would expect a hospital to have. We also have, right behind the hospital, we have Dr. Meena Patel's office, the pediatric office that's a part of Breckinridge Health, and so we serve all ages, and there's a lot that we can do to keep you home and keep you close, and if you need to go elsewhere, we'll be here when you get back, and if you need us then, we'll be here. I think we got it.
That's why I asked you to do that. You did a lot of that I didn't even think of. And I've had procedures with 2 of the clinics so far. Dr. Peebles in podiatry and Dr. Gillum in surgery.
Yeah.
And I think there's like 7 different clinics or something. I was joking one day and I said, my goal before I pass on is to have a procedure in each of the clinics. But I may have used up that time right here, but I'm sure glad, because emotionally it was very, very calming and pleasurable to be back here than I was in Louisville. And I got good treatment up there, don't complain about that, but I was just a number.
Yep. It's very, very common for us to take patients into the program that Roger's been in, into the rehab from home, or rehab to home. Patients who've been in Louisville and they've been distance from their family, distance from their homes, but even the environment, the atmosphere, it's quiet here. There's not sirens all day, all night, and planes and things. So it's very, very common when we have patients come back to us that as soon as they get here, you can just see the relief. They kind of let go and relax because they're in a place that just feels more familiar and they can have more family interaction. And I absolutely believe that is imperative to healing. So we're very proud of you.
Well, thank
Glad
you.
we could help.
I'm proud to be here, and I feel honored to be able to do what we're doing here now, because it's just been and a very pleasant emotional experience for me to be here. And I remember the ride home from Louisville. I just can't wait to get there. And of course, we just live less than 2 miles away, so it's been much easier for my family to come here and be with me, and that's a big help too. It's one of those things you don't normally think about, but when you have when you're able to enjoy family support, it's a lot better.
It definitely
is. I've made a lot of progress, and I'm not bragging, but I'm bragging on the therapists because they're the ones who've done it. They're just simply outstanding. Yeah. And I told them when I got here, I said, I want you all to tell me what you want me to do, and I'll do it, and don't cut me any slack. And they haven't.
And it served you very well.
Oh, they have. They have. They're worth their weight in gold. Right. And again, we're very fortunate that you've been able to find people like that.
And I agree with you. Of all things that I that I count in my blessings and what I can get done in a day, hiring the wonderful people that are here. That are, we all have the same goal in mind. We're family too.
Mm-hmm.
We have our good days and bad, but at the end of the day, it's the patients who matter, and that's what makes a difference.
Well, I've not had an unpleasant experience in any shape, manner, or form.
All right. Well, we wish you all the best.
Well, thank you.
And we'll be here if you need
Well,
us
I'm
ever
coming
again.
back to visit when I can really walk.
All right. We're going to hold you to it.
I'm just kind of stumbling forward right now, but that's a lot better than the first day I was here, I couldn't even sit up on the bed.
Nope. No, you've come a very long way.
Well,
Congratulations, sir.
thank you, ma'am. I appreciate it all.
All right. Okay. So that's Rehab to Home, and you can see your primary care provider. You can call us here at the hospital for more information. Happy to help if we can.
And I encourage you to do so.